Imagine a drug-free, surgery-free, natural way to alleviate your pain and aid your body in its own healing. Throughout my speech today, I hope to inform you about chiropractic care to provide you an overall understanding of the science. I am sure you have all heard of chiropractic but may not truly understand what it is. As a chiropractic patient for over 10 years and someone with a desire to become a doctor in the field, I not only have personal experience, but I also have done an extensive amount of research on the subject. The main points I will cover today are the history of chiropractic care, the treatments and techniques used on patients, as well as some of the skepticism that it faces. First, I want to tell you about the history of chiropractic. Chiropractic is a relatively new theory in the medical field, spanning a little over 120 years. In 1895, Daniel Palmer performed the first chiropractic adjustment. Harvey Lillard, a janitor working for Palmer, stated that he suffered from a partial hearing loss since turning the wrong way and feeling a pop in his back. Palmer noticed Lillard had a lump on his spine, which he thought could be a misaligned vertebrae. Palmer performed a manual adjustment to realign the vertebrae, and Lillard returned a few days later, exclaiming his hearing had returned. Palmer used this case as the basis of his theory of chiropractic. He described the body as a machine whose parts could be manipulated to produce a drugless cure. His theories revolved around the concept that altered nerve flow was the cause of all diseases. He assumed that restoring vertebrae to their proper alignment would restore health. The first College of Chiropractic study opened in 1897. According to the American Chiropractic Association, there were more than 70,000 chiropractors in the United States who were required to pass a series of 4 national board exams and be state licensed. Next, I would like to talk to you about the techniques and procedures used in a typical chiropractor visit. A visit to the chiropractic office is different from a regular doctor visit. Upon arrival, you will complete a new patient intake paperwork, which will inquire about all your current symptoms as well as any health issues you may be suffering from, including high blood pressure, IBS, migraines, allergies, as these are all issues chiropractors seek to aid in the healing process. According to chiropractic theory, your nerves become pinched when traveling through your spinal column. If you have a misaligned vertebrae, these pinched nerves prevent the electrical pulse which travel along the nerves from reaching their destination, thus stopping the organs or relative area of the body from functioning properly. The idea of chiropractic adjustment will realign the vertebrae, allowing the nerves to function properly. During initial visits, x-rays are taken with an examination with palpations is performed. Palpations is the method of feeling with the fingers and hands during a physical examination, as defined by medlineplus.gov. At this point, the adjustment and treatments will begin. Patients will most likely receive their adjustments while laying on an adjustable table, which has moving parts to assist in the adjustment. On their website, Mayo Clinic defends chiropractic adjustments as a procedure in which trained specialists use their hands and small instruments to apply controlled sudden force to the spinal joint. The goal of this procedure is to improve spinal motion and improve your body's physical function. Some chiropractors believe in utilizing various forms of physical therapy after the adjustment. This can include decompression therapy for compressed vertebrae, exercise to assist in muscle strength, and traction therapy. Since most chiropractors do not believe in the use of drugs, when pain management is needed for patients' comfort, heat and ice therapy are utilized. With the ease that chiropractic care can provide in terms of non-invasive, drug-free treatment options, there are still some skeptics of the theories behind chiropractic care. Non-believers claim chiropractic care is rooted in pseudoscience. As Daryl Cunningham, a respected science writer, described in his myth-debunking book, Daryl Palmer, that is the father of chiropractic, stated, "Subluxations block the body's innate intelligence, carrying both physical and psychological significance. This tinged early chiropractic practice with religion, which most people openly opposed. This combined with extremists who disagree with traditional medical interventions, make people speculative to the field of chiropractic and ignore its possible benefits. To this day, there is a strong correlation between Christianity and chiropractics, outlined in the book The Healing Gods, which adds some non-medical speculations about chiropractic care. This concludes my informational overview of chiropractic care. Throughout my speech today, I provided you with an overall understanding of the science. I discussed the history of chiropractic care, an overview of the techniques, as well as provided you with some information about skepticism of the field. I hope you can take this information and make your own educational decisions about chiropractic care.